Burning during urination is one of the most alarming sensations a person can experience, and for most people, the first thought is always the same: infection, a urinary tract infection, a bladder infection, or something bacterial. But what happens when tests come back normal, urine cultures show no bacteria, and yet the burning sensation continues day after day? This is far more common than people realize, especially in men and women over the age of 40, and it is often misunderstood, misdiagnosed, or completely ignored. Today, we are going to carefully and clearly explain what burning urine without infection really means, why it happens, what is going on inside your body, and most importantly, what your body may be trying to warn you about long before serious damage occurs. Let's begin by understanding one critical fact that most people are never told. Burning during urination is not a disease by itself. It is a signal. It is your nervous system and urinary tract reacting to irritation, inflammation, chemical imbalance, pressure changes, or nerve dysfunction. Infection is only one possible cause, and in many adults, especially those over 40 or 50, it is not the most common one. In fact, repeated antibiotic use in people who do not actually have an infection often makes the problem worse by disrupting protective bacteria and irritating the bladder lining even further. One of the most overlooked causes of burning urine without infection is bladder inflammation, a condition known medically as interstitial cystitis or painful bladder syndrome. This condition does not involve bacteria, but it causes the bladder wall to become inflamed, sensitive, and reactive. When urine touches the irritated bladder lining, it produces a burning or stinging sensation that feels identical to infection. People with this condition often notice that symptoms worsen with stress, dehydration, caffeine, spicy foods, artificial sweeteners, and acidic drinks like soda and citrus juices. The bladder becomes hypersensitive, and even normal urine can feel like acid passing through. Another extremely common cause, especially in men over 45, is prostate inflammation without infection, known as non-bacterial prostatitis. The prostate sits directly below the bladder and surrounds the urethra, the tube urine flows through. When the prostate becomes swollen or irritated due to hormonal changes, pelvic muscle tension, prolonged sitting, cycling, or chronic stress, it can squeeze the urethra and irritate the surrounding nerves. This creates a burning sensation during urination, discomfort after urinating, pelvic pressure, or even pain that radiates to the lower back or groin. Because no bacteria are present, urine tests appear normal, leading many men to feel confused or dismissed. Hormonal changes also play a powerful role, particularly in aging men and postmenopausal women. As estrogen levels decline in women and testosterone levels gradually shift in men, the protective lining of the urinary tract becomes thinner, drier, and more fragile. This condition, sometimes called urogenital atrophy, makes the urethra far more sensitive to normal urine flow. What once felt neutral now feels like burning, stinging, or irritation. This is not an infection, but a structural and hormonal change that requires a completely different approach than antibiotics. Dehydration is another silent but powerful trigger. When the body is not adequately hydrated, urine becomes highly concentrated. Concentrated urine contains higher levels of waste products, salts, and acids that can irritate the urethra and bladder lining. Many people unknowingly drink less water as they age, especially if they are trying to avoid frequent urination. Unfortunately, this creates the perfect environment for burning sensations, even in the absence of infection. Dark yellow urine is often a clear sign that irritation may follow. Kidney stones or microscopic crystals are another cause that frequently goes unnoticed. Even very small stones or mineral crystals can scrape or irritate the urinary tract as they pass, producing sharp burning sensations without infection. These episodes may come and go, sometimes accompanied by mild back pain, groin discomfort, or cloudy urine. Standard urine tests may miss this unless imaging or specialized testing is done. Nerve-related causes are also increasingly common, especially in people with diabetes, spinal issues, or chronic pelvic tension. The bladder and urethra are controlled by a complex network of nerves. When these nerves become overactive, compressed, or damaged, they can misfire pain signals during urination. This condition is known as neuropathic bladder pain, and it often causes burning, urgency, or discomfort without any physical damage or infection present. Stress and anxiety can dramatically amplify these nerve signals, making symptoms worse during emotionally difficult periods. Chemical irritation from everyday products is another overlooked factor. Scented soaps, bubble baths, harsh detergents, intimate hygiene sprays, and even certain toilet papers can irritate the urethral opening. In sensitive individuals, repeated exposure leads to inflammation that causes burning with urination. The body reacts defensively, even though no infection exists. Diet plays a surprisingly large role as well. Acidic foods, alcohol, caffeine, spicy meals, artificial sweeteners, and carbonated drinks can all irritate the bladder lining. For someone with a sensitive urinary tract, these substances turn normal urine into an irritant. This explains why some people experience burning only at certain times of day or after specific meals. Now, it is very important to understand when burning urine without infection becomes a warning sign that should not be ignored. Persistent burning lasting more than 2 weeks, burning accompanied by blood in the urine, unexplained weight loss, severe pelvic pain, or difficulty starting urine flow requires medical evaluation. While most causes are not life-threatening, early detection of structural problems, prostate enlargement, or bladder disorders is essential for long-term health. The most dangerous mistake people make is self-treating repeatedly with antibiotics when no infection is present. This disrupts the microbiome, weakens natural defenses, and increases inflammation. Instead, the focus should be on identifying irritation triggers, improving hydration, calming inflammation, supporting hormone balance, and protecting nerve health. In many cases, simple changes can dramatically reduce symptoms. Increasing water intake, avoiding bladder irritants, managing stress, limiting prolonged sitting, and supporting pelvic floor relaxation can bring relief. For some individuals, targeted supplements, physical therapy, or medical guidance may be necessary to calm chronic inflammation. The most important message to remember is this: burning urine without infection is not in your head, and it is not something you should simply tolerate. It is your body signaling imbalance, irritation, or dysfunction long before serious disease develops. When you listen early, you protect your kidneys, bladder, prostate, and nervous system for the future. If you or someone you love has been struggling with unexplained burning during urination, understand that answers exist and relief is possible once the true cause is identified. Your body always speaks before it breaks. Learning to understand these early signals can preserve comfort, confidence, and health well into older age.